Now, Health and Human Services Secretary Tom Price was recently asked to defend a tax cut for health insurance CEOs during a healthcare town hall. Now, the American Health Care Act, of course, which is the replacement for Obamacare, cuts taxes on the wealthy to the tune of about $600 billion a year. That includes a very generous tax cut for people who are in the health insurance industry, who are health insurance industry CEOs. Now, of course, Price is going to be asked to defend this during this town hall. Let's take a look at that.
Why do healthcare CEOs need a tax break?
Yeah, I don't think it stipulates that it's healthcare executives. I think it's the level of income. If it's healthcare executives, then I'll take a peek at it. It doesn't make any sense.
It is. I mean, it's in there. It talks about, I have it right here.
I'll tell you what I think that is. I think that the previous administration singled out healthcare executives. You're absolutely right. And what they said is healthcare executives ought to be punished.
Well, not punished, a limitation for wealthy people. It said Obamacare had a limitation for certain health insurance providers that exceeds $500,000 paid to an officer, director, or an employee. That limitation in your bill goes away, and it effectively means a tax cut for these people.
You think about what this is, Dana. This is the federal government before saying to a certain sector of society, a certain individual, you can't make what that company is willing to pay you for your services. That doesn't sound like America to me. What we're saying is that we ought not single out certain individuals in this nation and have the federal government have the power to be able to say you're going to be treated differently than that individual even though you make the same amount of money. If we want a health system, or if we want an income system that taxes everybody at a certain income level the same, that's what I think the American system's all about.
Well, but the current tax system doesn't tax everybody the same. People are taxed differently.
At a certain income level. And the fact of the matter is what the previous administration did was to identify, you read it, identified individuals in a certain sector of our society and said, you've got to pay more than the guy or the gal down the street who's making exactly the same amount of money as you. That seems very dangerous to me.
Oh, it's very, very dangerous. Very dangerous. Hey, you know what's actually dangerous? It's really dangerous? Taking 24 million people off health insurance. That's kind of dangerous. Look, what he's doing is he's defending a tax break for insurance CEOs. Now, what the Obama administration did to help pay for subsidies for people who couldn't normally afford insurance is to say, hey, we're going to put a limit on executive compensation. Right? For you CEOs in the healthcare industry, you can't do that. What you have to do is actually put more of your money that you collect in premiums in taking care of people who pay the premiums. That's sensible. And besides, don't cry for these health insurance CEOs. They make millions of dollars per year. I think they're going to be fine without a $500 million a $500 million tax break. That tax break, by the way, goes to help, again, people who are not millionaires be able to afford health insurance. Now, Price thinks that doesn't sound like America. That doesn't sound like America to me. So making sure that people get health care isn't American? You know what? Actually, he's kind of right about that. We're the only modernized nation that does not offer universal health care to all of its citizens. So you know what? It is American. It is uniquely American. That's the problem. We're doing it wrong. We're doing it wrong. We could actually do something better. We could actually do something like a real universal single-payer healthcare plan. But they don't want to do this. Tom Price doesn't want to do this. Paul Ryan doesn't want to do this because he doesn't believe that people who are poor deserve health care. And that's the problem here. He is another opponent of poor people getting access and being able to afford health care. That's the problem that we have. They don't give a shit about you. They don't give a shit about your health care. All they care is about how much they can give to their wealthy donors and to the insurance company CEOs. These are their priorities, and they say it exactly. They're not hiding it. They're for the rich and not for you. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.